Assalamu alaikum, Dr. AhmedZeeshan here again, and today our topic of discussion is a new chest X-ray, and this was a X-ray of a patient who presented to us with a history of low-grade fever from last 1.5 months, and he had loss of appetite from 1 month, and he had weight loss of about 10 kgs in last 1.5 months. He was having hemoptysis from last 10 days. So after we did his X-ray, I am showing you this film. This is a chest X-ray PA view, which is showing here. This is a chest X-ray PA view, and it is having trachea centrally placed. However, both clavicles are also equally arranged, uniformly arranged on both sides. However, you can see in both zones of you can see in upper zones of both lungs there are fluffy shadows. This is the first rib, this is the second rib, and this constitutes the upper zone of right lung. And however, same here in upper zone of left lung, and it's also these lesions are extending to the mid zone. Here you can see here there is a small space whose boundary is traced by me, and this is known as cavity, and this is pathognomonic of X-ray of a tuberculosis patient. A cavity is defined as any lesion in the chest X-ray whose 2/3 of the wall can be traced and it is inside filled with the air. So this is the boundary of this cavity, and inside it is having hollow space or air within it. And in upper zone, coming towards discussing this lung, there are fluffy shadows in upper zone, and it is called as consolidation, because Mycobacterium tuberculosis is aerobic organism, and it loves to live in a high oxygen supply area, so it attacks the upper zones of the both lungs. Here you can see consolidation involving the upper zone of the right lung, and in this lung, in upper and middle zone, there are small fluffy shadows, patchy consolidation. These are patchy consolidation. These are the lesions which are characteristics of Mycobacterium tuberculosis. On both sides there is perihilar congestion. These are most likely the paratracheal lymph nodes on the both sides, and these are also characteristics of tuberculosis. And whenever we are discussing the diaphragm, this is the right diaphragm, this one is the left diaphragm. However, here this lesion, this area of the lung is quite hazy. This is showing that there is some pleural effusion in the lower zone of this left lung. So concluding this session, I will say in this X-ray there is a cavity in the mid zone of left lung. There is patchy consolidation in upper and middle zone of left lung, and consolidation in the upper zone of right lung. There is perihilar congestion in both lungs, and there is blunting of left costophrenic angle. Most likely this is having pleural effusion. If we compare this area to the right lower zone, you can see here, if I draw similar kind of triangle here, in this area this is quite darker. It is showing the lung parenchyma here. There is no blunting of this costophrenic angle here, and this area is showing parenchyma of the right lung, whereas in the left lung there is blunting of left costophrenic angle, and most likely it is having effusion. So what we will do in this patient, we will do the sputum complete examination or sputum for AFB smear, and we will send sputum for gram staining culture sensitivity, and after that we will decide. And most likely this is a X-ray of Mycobacterium tuberculosis. Thank you very much.